Gay men have a slightly different life experience than heterosexual men. Of course, we deal with things like homophobia, and even in an accepting society like Canada, gay men still suffer discrimination. Acceptance of homosexuality is not universal. And we also live with a lot of stigmas and stereotypes, which are probably not well-founded. So when we interact with the healthcare system, healthcare providers need to know exactly what our experience is like, which is different than the average heterosexual man. I think the Ottawa Hospital can lead here as an institution that will prioritize minority health, and among minority health would be gay men's health. A good proportion of men don't disclose their sexual orientation. We found that the healthcare providers were screening these men for common health conditions like diabetes and heart disease and high blood pressure, but perhaps out of not knowing they were gay or not knowing what some gay men's health issues were, they were overlooking mental health issues and other sexual health problems like sexual dissatisfaction, sexual anxiety. All these things were being missed. So we want to take a very large view of gay men's health, including epidemiology, but also the psychosocial factors. Certainly HIV will be in there. But also we also found somewhere around 16 to 20% of gay men scored as depressed and or anxious in our survey, which is quite far above the national average. And 30% reported a lifetime history of depression, which is much above the 10% in the general population. When we looked at guys who lived in core downtown Ottawa, and then we looked at guys who lived in the suburbs versus guys who lived in like the smaller towns, like, as you say, Cornwall, Perth, Arnprior, Manotick, we saw disparities in healthcare delivery depending on where they lived. So the guys who lived, the further you got out of the city, the less likely they were to be out to their healthcare provider, the less likely they were to test for HIV, the less likely they were to seek mental health support. So we know about, the Champlain Inn is almost like a microcosm for understanding how gay men function both in cities and outside of urban centers. So again, it makes Ottawa kind of an attractive place to do this kind of research.